Hello, and welcome to the Tahoe Center for Orthopedics pre-surgical class for total joint replacements. We know that you have many choices when it comes to your health care, so we sincerely appreciate you choosing Barton Health. The disability that goes along with degenerative changes in our joints severely impacts quality of life. Whether you've been living with pain, not able to do the things you want to do, or both, your total joint replacement will very likely give you back that quality of life. So without further ado, let's jump into the program. In this presentation, we'll be talking about how to prepare for your surgery, understanding your surgery, and what to expect with your hospital stay, with rehabilitation, and with your recovery at home. The content in this presentation is also in the total joint booklet that your surgeon gave you or will be giving you soon. Our goal for you is, quite simply, to get you back to the activities and lifestyle you're used to, and to do so as quickly and safely as possible. Preparing for your surgery, planning ahead. You're going to want to have somebody available to take you home from the hospital after your surgery and then stay with you for the first week. Remember, this is a major surgery and you will need help. It's also a good idea to make or stock up on ready-to-eat meals such as frozen dinners or microwavable meals that can be easily made. These meals are invaluable if your caregiver isn't available to cook when you're hungry. Our home health therapists have either contacted you or will be contacting you to schedule a home safety assessment. If you live locally, we'll arrange a time to come to your house and perform a home safety assessment. If you are an out-of-town guest, our therapist will conduct the assessment over the phone. Nonetheless, here are a few tips. Remove throw rugs and small objects such as pet toys and shoes from the floor. Add pillows to low chairs or sofas. Prepare a bedroom on the main living area. And make sure electrical or phone cords are not crossing walkways. In the bathroom, make sure you have non-slip mats inside and outside your bathing area. If you have a step-over tub, you may need a tub transfer bench. And a commode can be very helpful to elevate the toilet seat or to have near the bedside. Before your surgery, you will need to obtain surgical clearance from your primary care physician. You will also want to discuss your medication regimen with your primary care doctor or pharmacist prior to surgery. Our preoperative coordinators will let you know which medications to take on the day of surgery. Blood work, chest x-rays, and an EKG are required prior to your surgery. Blood work must be completed within 7 days of surgery, and the chest x-ray and EKG can be within 6 months if they have normal results. When you're preparing for your hospital stay, the following items are recommended. 2 to 3 pairs of comfortable, loose-fitting clothes. Shorts are ideal for total knee replacements. Slip-on shoes or slippers with non-slip soles. Books, magazines, or leisure activities that can be used in bed. Glasses if needed, and a walker if you have one. If not, we'll provide one for you. Be sure to label all of your belongings. What you don't want to bring to the hospital are some of the following items: jewelry, money, ATM or credit cards, and your medications. Our pharmacy will fill any needed prescriptions for you to take while in the hospital. If there are any changes in your physical condition in the days before your surgery, it is very important that you let your surgeon know. This includes colds, coughs, or any injuries, especially to the joint being replaced. If you become ill the night before surgery, please notify the nursing supervisor at 530-543-5736. On the night before surgery, it is very important that you do not eat or drink anything after midnight. This includes water, mints, candy, and chewing gum. The only exception is a sip of water with medications that you have been specifically instructed to take. It is okay to brush your teeth or rinse your mouth out, just be sure not to swallow. It is also important to refrain from smoking, using smokeless tobacco, and consuming alcohol for at least 24 hours prior to surgery. What to expect on the day of surgery. On the day of surgery, you will report to the surgical desk in the front lobby of the hospital. This kiosk is just inside the main entrance to the hospital. Our representative will activate your account, give you an identification wristband, and escort you to the ambulatory surgery unit. Please know that your surgery time is subject to change. If it does, you and those with you will be notified. Also note that you should not wear contact lenses on your surgery day. If you need corrective lenses for reading, please bring your reading glasses. Once you are in the ambulatory surgical unit, you will be introduced to the nursing staff and your height and weight will be taken. You will then change into a surgical gown and we will confirm your identity, what surgery you are having, and which side of your body the surgery is going to be on. Our surgical team will then continue your preparation for surgery and conduct a coordinated review of your medical and surgical history. Please know that you will be asked the same questions by many members of our surgical team. This redundancy is intentional and purposeful. We want to be absolutely sure that the right surgery is performed on the right person every time. Prior to your surgery, you will meet with your anesthesiologist and he or she will explain how your anesthesia will work. After that, An antibiotic will be administered, and then you will be given medication that will relax you and allow you to go to sleep easily. This will most likely be the last thing you remember prior to going into the operating room. Understanding your surgery. We'll now take a few minutes to discuss the differences between healthy joints and degenerative joints and what your new joint will look like after surgery. Total knee replacement. On this x-ray of a healthy knee, you can see a substantial space between the two main bones. The meniscus of the knee lie here and help allow shock absorption and cushioning for the knee joint. As we move to the picture on the left, you can see how that nice space between the bones has now disappeared. What we're seeing is bone on the inner aspect of the knee joint. The picture on the right demonstrates the new knee joint. Notice the reclaimed joint space and improved alignment. Here we have a healthy hip joint. You can appreciate the round shape of the head of the femur and how it fits nicely into the hip socket. Now, looking at the picture on the left, you can see the degeneration and destruction of the hip joint. On the right, you can see the new hip, the reclaimed joint space, and alignment. What to expect in the recovery room, or what we call the PACU. It's good to know that when you wake up after your surgery, you'll have quite a few things on your body. You'll have an oxygen mask on your face, a blood pressure cuff on your arm, a pulse oximeter on your finger, an IV in your arm. Your incision will be covered in surgical dressings. You'll have compression stockings and compression pumps on your legs. You may also have a catheter in your bladder, a drain from the incision site, and possibly a nerve block in your inner thigh, which is similar to an IV. In the PACU, you will receive pain medication and any other medications indicated by your doctors. At this time, the surgeon will notify your family that the surgery is complete and will be able to answer questions that they may have. You will stay in the PACU until your vital signs are stable and you are awake. At this point, which is usually about an hour or so, you'll be transferred to the nursing unit on the second floor. When you get up to the nursing floor, our nursing team will get you acquainted with your room, check your vital signs and circulation, assess your surgical site, and help you manage any pain you may be having. We will be doing everything we can to expedite your recovery. It is very important to us that your pain is managed well. When this is accomplished, you are able to move with less difficulty, get in and out of bed easier, participate in therapy, and rest soundly and comfortably. Please know that it is your responsibility to request pain medication. If your pain is progressively increasing, you need to let the nursing staff know right away. Do not wait until your pain is severe before asking a nurse for pain medication. It is much easier to manage lower levels of pain than to try to bring high pain levels back down again. We also use cold packs to help manage pain, so feel free to ask for one if you'd like. With any surgery, there is always the risk of complications. Some complications, such as nausea and constipation from anesthesia and pain medications, are very common, and we will work very hard to help manage those issues. Prevention of more serious complications like pneumonia, blood clots, infections, falls, knee contractures, and hip dislocations are taken very seriously. Our rehabilitation team has 6 basic goals for you to achieve. Get in and out of bed on your own. Get on and off a chair or toilet safely. Walk safely with an assistive device. Dress yourself with minimal assistance. Go up and down stairs safely. And return home within 3 days after surgery. We'll talk next about joint-specific goals. If you're having a hip replacement, it's important to know if you are having a posterior or anterior approach. Your surgeon can let you know which procedure you're having if you do not yet know. For a posterior approach hip replacement, you want to avoid turning your knees in or out significantly. You also need to avoid crossing your operative leg across the midline of your body or over the other leg. Lastly, you need to be sure to keep the angle between your hip and trunk less than 90 degrees. That means no lifting the leg up past 90 degrees or bending forward. The precautions for an anterior hip replacement approach are a little different. You want to avoid pivoting on the operative hip and turning away from that side. You need to shorten your step length and avoid taking long steps with the non-operative leg. And lastly, you want to avoid letting the leg roll out to the side when lying down. If you are having your knee replaced, the precautions are much simpler. Do not put a pillow under your knee and try to keep your knee all the way straight when resting. This is important to avoid a knee contracture. Our goal is for you to be able to move your knee from a fully straightened position to 90 degrees. During your stay with us, you will be participating in physical therapy twice a day, occupational therapy once a day, and you will be expected to get up and eat all of your meals out of bed. Our physical therapy team will be working with you to improve your functional mobility, increase your range of motion, increase your strength, and help decrease pain, stiffness, and swelling. Our occupational therapy team will be helping you with the performance of activities of daily living, or ADLs as we like to call them. ADLs include activities such as getting dressed and undressed, toileting, bathing, and grooming. Our occupational therapists will also instruct you in the use of adaptive equipment to make ADLs easier and safer. Going home. It is our goal to get you back home within 3 days of your surgery. In the unlikely event you are not ready or able to return home, you may be referred to a skilled nursing facility or an inpatient rehabilitation center. Our case managers will coordinate the care you need to leave the hospital. In most cases, your doctor will recommend home health services to assist you with your recovery at home. The home health team includes registered nurses to inspect your surgical incision, change dressings, help you with pain and medication management, provide an ongoing physical assessment, and draw blood if needed. Our home health nursing team is available 24 hours a day, 7 days per week. Physical therapists will progress your strength, range of motion, and walking while ensuring safety and mobility throughout your home, ultimately preparing you for a safe return to the community. Occupational therapists will progress the performance of ADLs, assess home safety, and make recommendations for safety equipment. Preventing infections and caring for your surgical wound is very important. Be sure to keep the incision and dressing clean and dry, which means no showering until your surgeon says so. And also, clean your hands thoroughly before changing your dressings. You'll want to examine your surgical site daily for any signs of infection. These signs include redness, tenderness, or swelling around the incision, a leg that is warm to touch, or if you have a persistent fever that is 101 degrees or more, drainage that looks like pus or smells bad, increased pain with both activity and rest and is not controlled by medications. Please notify your home health nurse or surgeon immediately if you develop any of these signs. Eating healthy foods will also aid in the healing of your incision. It is important to continue the medication regimen that was given to you prior to leaving the hospital. If your pain medication is not relieving your pain or you are having unwanted side effects, please do not hesitate to call your nurse or surgeon. As mentioned earlier, preventing complications is of utmost importance to us. Measures to prevent blood clots will continue during your recovery at home. If you are given compression stockings, you'll want to wear them until your follow-up appointment with your doctor. However, be sure to remove them once a day to inspect your skin for breakdown. Continue the foot pumping exercises that the nursing and therapy teams instructed you in while at the hospital. Lastly, be mobile. Getting up and moving every hour or two helps prevent blood clots as well as pneumonia while promoting circulation and healing in your new joint. We don't expect you to have a blood clot, but we do want you to know the warning signs just in case. Signs that you may have a blood clot include increased pain in your calf, ankle, or foot, increased swelling in your calf, ankle, or foot, tenderness or redness above or below your knee. The area is warm to the touch. If you develop or even think you may be developing any of these signs, contact your home health nurse or surgeon immediately. Making the choice to have a total joint replacement is a big decision and a life-changing decision. We are hopeful that this operation will help you get back to the activities and lifestyle you are used to, and we are committed to helping you get there as quickly and safely as possible. We sincerely appreciate your patronage and look forward to making your experience with us positive, rewarding, and successful. If there is ever anything we can do to enhance or improve your time with us, please do not hesitate to ask. From all of us here at the Tahoe Center for Orthopedics and Barton Health, thank you for choosing us and congratulations on taking the next step to a new you. Barton Health, taking your health to new heights.